Hello, and thank you to Physical and Occupational Therapy in Pediatrics for the opportunity to share our work. I'm Nili Weisserberg, and I'm presenting on behalf of my co-author Paula Feder-Bubis. Our article, This is Something Else, It's Not Like Physical Therapy in the Clinic, on stakeholders' perspectives of school-based physical therapy. The word physiotherapy indicates physiotherapists provide health services and work in health spheres. Yet physiotherapists do not practice only in health and medical settings. Like in other countries, the Israeli Special Education Law specifies physiotherapy services for children with motor disabilities are provided within education settings. They can study at special education schools or be included in mainstream schools. Thus, despite its recognition as a health profession, part of pediatric physiotherapy practice occurs in educational, not medical settings. This poses questions about the nature of the practice provided to these children in these settings. The purpose of our study was to explore how physiotherapists, children with motor disabilities, caregivers, educational personnel, and physicians who refer the child for therapy describe and characterize school-based physical therapy. We conducted a qualitative study that included 8 in-person focus groups, 4 with children with motor disabilities and 4 with caregivers of children with motor disabilities at special education schools. To achieve maximum variation sampling, the focus groups met in different parts of the country. The children ranged in age and were variable in motor functioning and cognitive functioning. We also conducted 25 interviews with school-based physiotherapists, educational personnel, pediatric orthopedics, and pediatric neurologists. The interviewees' sampling was also chosen for maximum variation in years of seniority, geographic region, and the educational setting where they work. The collected data were transcribed and reflective thematically analyzed. We ensured that the study trustworthiness using the constant comparison method, peer debriefing, reflexivity, and audits. 2 themes were developed. The first theme, physical therapy in the lives of children with motor disabilities, refers to physical therapy in general. Participants use terms as health, oxygen, and crucial to describe physiotherapy. They perceive physiotherapy in general as basic to children's life and essential to their functioning. The second theme, something different, refers to school-based physical therapy and includes sub-themes regarding physiotherapy's scope of practice, relationships, and sense of strangeness in school-based settings. Participants clearly distinguished between school-based physiotherapy and physiotherapy in health settings. The latter was linked especially with body function and structure. Like Guy said, when it rains and we can't exercise and play outside, we go inside the school, take mattress, and do stretching just like in the hospital. They described that school-based intervention impact all ICF domains, including participation in school and in leisure activities. And they also described the school environment offer various options for the physiotherapy intervention, enabling different therapeutic opportunities. In contrast to school-based practice that takes place within the child's natural environment, physiotherapists describe the clinical practice as disconnected to children's participation and frequently use the term laboratory for describing this practice. Another difference is the long-term point of view at educational settings compared to clinical ones. Also, role partners really appreciated the school physiotherapist relationships and familiarity of the child. School-based physiotherapy allows a holistic point of view that emphasizes individuals' participation in their own environment. It enables an appropriate intervention for the daily needs of the child. Participants described school-based intervention aiming at all ICF components. They described a broad practice that takes place within and outside the treatment room, having a direct and indirect impact on the child. Like one of the physiotherapists said, the most important part of my job is guiding and showing the children's teacher how to work with them effectively. Participants perceive the school-based physiotherapist as a coordinator of care and a mediator between the medical and educational systems, between the child caregiver and doctors, the child and caregiver and the educators, and sometimes even between the child and his parents. And like David, a pediatric orthopedic, said, they have to work closely with me and with psychologists and with social workers and neurologists, with school staff, so it sounds like the physiotherapist must be Superman. They must be a superhero to manage all of these responsibilities with such a heavy workload. Participants described a two-way estrangement. The educational setting does not know what to expect of the physiotherapists, who in turn do not always know what their role is in that setting. The need for physiotherapy is clear at schools for children with motor disabilities, but it is unclear at schools for other special needs, like school for ASD or school for mild intellectual disabilities. The estrangement is even more significant at mainstream schools. Like one physiotherapist said, working as a physiotherapist at mainstream school was a lonely experience for me. It felt like I was thrown into the position. So we can summarize these results based on Bronfenbrenner's ecological system theory. Using this point of view, physiotherapy practice in educational settings has significant impact at multiple levels. It occurs both inside and outside the physiotherapy room and has both direct and indirect influences. It involves connections between people and organizations that surround the child, and it is guided and constrained by laws, policies, and contemporary philosophical models like the ICF. It is also influenced by global changes and events, such as the needs to integrate telepractice during the COVID-19 pandemic. Part of pediatric physiotherapy is provided in educational settings, encompassing many potential opportunities for holistic intervention in the child's environment. It expands the boundaries of the profession. However, the estrangement may push professionals to limit themselves to a narrower familiar professional practice. It is then that the children do not benefit in full from what school-based physiotherapy can offer. Intervention in educational settings cannot be compared to that given in medical settings, nor can it be substituted by it. It should be explicitly taught, since it is not self-explanatory, and school-based physiotherapists must be exposed to continuing education aimed at working in educational settings. Thank you for watching. We are deeply grateful to the children, parents, and professionals who share their time, thoughts, and perspectives with us. And we sincerely thank Physical and Occupational Therapy in Pediatrics for the opportunity to share this work.